So this is the anterior view of the heart. We have over here the right atrium, the right ventricle, the left ventricle, and the left atrium. Inside the right atrium, and only on the right atrium, we have this wall of muscle that's called the tectonic muscle, and this is the muscle that will help to push the last little 30% of the blood from the right atrium into the right ventricle. Also, inside of the right atrium, we have the fossa ovalis, which is the opening that is present during embryonic development that allows the right atrium to communicate with the left atrium. And the other structure that we have in here is the opening of the coronary sinus. So all the blood that's draining from the heart itself will come back to the heart through the coronary sinus and empty in the right atrium through the opening of the coronary sinus. Then the first valve that we have is the atrial or right atrioventricular valve. So like the name says, atrioventricular valve, and it's on the right side, so right atrioventricular valve. Then we have, right over here, we have this structure here that is called the moderator band that is important during the impulse to carry the conduction of the heartbeat. And the last structure that we have that is not very good on this model, but this will be the pulmonary valve that carries the blood from the right ventricle into the lungs. So another model might be better for this structure. Then right over here, a couple other structures. These are these little flaps that are present in the valves. These are called the Chordae Tendineae, and they will attach to these muscles that come out that are called the papillary muscles. So this model is not the best model, but these will connect right over there. So the Chordae Tendineae connect to the papillary muscle, and you can see a papillary muscle right over here. And this septum that separates the right ventricle from the left ventricle is called the interventricular septum. So between ventricles, interventricular septum.